My name's Andrew Campbell. I'm an audiologist, and I'm here with my colleague who's also an audiologist, Jeffrey Pang, and we're here to discuss the topic of tinnitus. We work primarily with adults that have hearing loss, and most of our patients do have tinnitus. Well over 70% of our patients have tinnitus. Tinnitus is, Jeffrey's going to explain the nature of it. And part of when we're talking about treating tinnitus, part of the treatment is actually education, learning the facts about it. There's a lot of potential misconceptions and I guess a general lack of understanding the facts of tinnitus. And what we tend to find is that when people really understand the nature of it, we're taking away the fear of the unknown and I guess in the process giving people the tools to be able to deal with it and cope with it better. So I might just hand over to Jeffrey to explain just a bit more about the nature of tinnitus.
Sure. So a little bit about tinnitus. In the simplest definition, tinnitus is the perception of sound in the absence of any acoustic stimulus. And it's very, very common in a very quiet room. About 95% of people will experience some form of tinnitus. And unfortunately for many people, it is quite concerning and can cause a lot of mental distress. And tinnitus is also more common in people with hearing loss, and the more severe the hearing loss, the more likely the person is to get tinnitus. But other than that, there's a number of different causes of tinnitus, and in most cases, it's not so much a reflection of a person's physical or biological health, but rather their mental health. So a little bit about how tinnitus works and what we call the negative cycle of tinnitus. When someone first perceives tinnitus, they become aware about it. And usually there can be a bit of anxiety and fear associated with a tinnitus because people might be afraid that it's a reflection of something sinister happening in the background. And that negative labeling of the tinnitus actually in turn makes it louder because then the brain focuses and becomes hypersensitized to the tinnitus, and the brain naturally latches on and really focuses upon stimuli that it deems to be negative. And in doing so, that means the person is more likely to pay attention to the tinnitus, which means it becomes even louder. And so you can see how it becomes a negative cycle.
The realistic goal when we're talking about treating tinnitus is to reach a point that we call habituation. So habituation means that like a clock ticking, refrigerator running, air conditioning, sounds that are around all the time that are not important to listen to, you habituate to those so you don't notice them all the time. If you listen out for them, you may still hear them, but you're not noticing them all the time. So with tinnitus, when we're treating it, and we treat it, one way in which we treat it is just like this through education. We want to get the tinnitus to be away from being the center of attention, often to the background where if you listen out for it, you may still hear it, like a refrigerator running, clock ticking, air conditioning, but it's not always right at the front and center of your attention. And the thing is, tinnitus in itself is it's generally a byproduct or a symptom of hearing loss. In and of itself, it's not threatening. It can be a nuisance. The extent to which it's a nuisance largely depends on like how well we think about it. I should just mention that we've put together a really comprehensive guide. It's called Tinnitus Essentials, and either click the link below or in the email in which our video came to you, you'll find a link to this resource guide. It's 65 pages long, and we really spell out the nature, like a lot of what we're talking about. We go into some more detail here. we're really spelling out the nature of tinnitus and some strategies to deal with it. Unfortunately, a misconception that a lot of people have, and they've been told sometimes by medical professionals and so on, is that nothing can be done about tinnitus. Well, what we've put together in this guide are some links to some really good resources, and they're right at the back of the guide if you scroll right down. One in particular is a 90-minute webinar by two world-leading experts. They're psychologists that focus on tinnitus treatment. And a particular point that they're at pains to point out is that when tinnitus sufferers are given the right advice and they follow the right kind of protocols, which are designed to help how you think about the tinnitus, 96% of tinnitus sufferers get to the point of habituation within a year to 18 months, sometimes a lot sooner. And it's purely on how well you think about it. So this notion of, oh, nothing could be done about it is completely untrue. Whilst like when we habituate to it, it may be off in the distance, we may still hear it if we listen out for it, but it's taking it from being problematic to something that you may experience. Taking it away from that center of attention to something off in the background is a realistic goal. And that really is effective treatment because we're taking away the nuisance factor of it. So saying that there's nothing can be done about tinnitus is almost like saying, well, nothing can be done about cancer, nothing can be done about diabetes, nothing can be done about coronary heart disease. There's no blanket cure for either, or for any of those chronic diseases, but there are effective treatments. And for tinnitus, there is most certainly effective treatments. One of the key elements for any tinnitus sufferer is just learn the facts about it, exactly what we're explaining to you now.
That's right. And it's a great point that you mentioned, Andrew, before, how the goal of treating tinnitus is not so much to get rid of it entirely, but to put it into the background, to phase it out into the background. So one example that I think we both like is the idea that if you're in the kitchen, you can probably hear just a background fridge hum if the compressor is on, but you're probably not focusing all of your attention onto that fridge hum. If someone told you that something bad was going to happen every time that fridge was humming, then you would probably pay a huge amount of attention onto the fridge hum. So relating it to tinnitus is to realize that it in itself is not harmful, it's not reflective of something sinister happening, and it's not something to be worried about. So to realize that if you do have the tinnitus, it's not going to keep getting louder over time in a linear fashion and trajectory, but it typically fluctuates. Usually it depends a bit upon your overall stress levels. If you're pretty tired and run down, that's usually when tinnitus is at its most severe, but maybe another day if you're feeling pretty peaceful and the stress levels are quite low, that's when the tinnitus is usually at its lowest point as well. So having that knowledge in itself is really, really helpful.
Exactly. So, I mean, the two key things that will make tinnitus worse for most people are stress and a lack of sleep. And we find that it can be quite instructive for people to really understand that, because if they find that there's a way to manage their stress or manage their sleep, and can see that there's a relationship to how loud their tinnitus is to their sleep or stress, then we tend to find that people start to get a sense of control over it and a better understanding as to the nature of it and how to deal with it. And it starts to become just far less mysterious. We're often asked, well, how does this relate to hearing loss? Well, I guess the reality is that people with hearing loss are far more likely to experience tinnitus, and they tend to experience it to be louder. They tend to hear it louder because of hearing loss. Well, why does that happen? Well, there's three main mechanisms at play. First of all, put simply, when there's hearing loss, the world is quieter for, to say I'm explaining to you you've got hearing loss. Well, the world is quieter for you in those regions where there is some hearing loss. How we can address that, when we treat hearing loss, usually with hearing aids, we're bringing the hearing back to a more appropriate level and reintroducing those softer sounds that everyone with normal hearing hears back into your experience. So that can have an effect of masking out or covering up the sounds of tinnitus, and that tends to happen relatively quickly with most people. Another thing that happens when we've got hearing loss is that we get this effect called brain gain. So the hearing centers in the brain start to become on high alert for whatever sounds that they can get to help compensate for the hearing loss. And so if we've got tinnitus there in the background, with that increased sensitivity that brain gain gives, tends to increase the volume at which we perceive the tinnitus. It just sounds louder. When we treat the hearing loss, then what occurs over about 10 days to about 2 weeks is that the hearing centers in the brain start to relax somewhat, particularly when people keep the devices in at least 12 hours a day. The hearing centers in the brain tend to relax somewhat, and that volume of the perceived tinnitus tends to turn down as well. A third mechanism at play, and probably the most accepted theory of tinnitus and why people with hearing loss experience it more, relates to the concept of phantom pain. So you may be familiar with the notion of someone losing an arm or a leg. Well, in fact, just say of people that have lost an arm, 86% of people that lose an arm will experience pain from that missing limb. Well, what's actually happening there is that whilst that limb might be missing, there still is part of the brain that should be receiving routine and consistent stimulation from that limb that's now missing. So the limb's gone, but that part of the brain's still there. And when we've got parts of the brain that are understimulated, they tend to behave in hyperactive or hypersensitive ways. And so someone with the missing limb, they'll experience pain, although that limb's not there. We see a very similar mechanism at play with tinnitus, where we've got a loss of sensitivity in the hearing system, and what that's doing is it's presenting a barrier or a hurdle for that stimulation to get through to the corresponding part of the brain. And so that understimulated part of the brain starts to behave in erratic, hyperactive ways. We hear tinnitus. So when we treat the hearing loss, what we're doing is we're overcoming the barrier or the hurdle that hearing loss is putting in place, and we're providing proper stimulation back into the hearing centers in the brain. And over time, just like going to the gym, these areas start to get back into better shape, and tinnitus at that stage tends to be reduced even without wearing hearing aids, even at nighttime. Each of these mechanisms, they work on their own time. They work on a different time frame. So reducing the amount of silence, that's a pretty immediate thing. Relaxing the hearing centers in the brain, reducing brain gain, that can take a few weeks. Getting these parts of the brain back into better shape by providing proper stimulation, that can take up 2.5 to 3 months. And it's really hard for us to tell how quickly treating hearing loss is going to result in relief. But I can't think of any patient that I've treated over the past 20 years that's had tinnitus, where we've treated the hearing loss, and particularly when they've got into the habit of keeping their devices in at least 12 hours a day, I can't think of anyone that hasn't experienced significant relief from their tinnitus from having it treated. So the effective treatment of hearing loss does require, for the most common forms of hearing loss, does require keeping devices in at least 12 hours a day. And particularly when tinnitus is concerned, and when tinnitus is part of the equation, getting into that habit of keeping the devices in at all waking hours, or at least 12 hours a day, is just the best advice we can possibly give.
That's right. And I like to think of it in terms of a bit of another analogy. So just imagine a pitch black room, and there's a candle, and you light the candle, and the candle becomes the focal point. And however, if you turn on the lights and you get a bunch of people into the room, the candle no longer becomes the focal point, and it becomes and other things like the other people in the room, the other lights in the room, that becomes the focal point. So it's a bit like, and it relates to the tinnitus in the sense that once you treat the hearing loss, it means that you hear more of the world around you, which means that relatively the intensity and severity of the tinnitus is it's not as loud, and you can hear more of the world around you. And certainly, as you touched on, after, usually it's around at least a few weeks, but after a couple of months of wearing the hearing aids on a consistent basis, the brain, it restructures itself, and those internal sounds of the tinnitus, it becomes reduced naturally.
There are actually parts of rural India where they believe that tinnitus is in fact the music of the gods, and people are actually quite happy to have it. Rarely do we have patients that can relate to that. However, I must say I had for the first time in my career, I had a patient that came in, and he had indicated that he has constant tinnitus on his form, and we were talking about that. And when we're asking our patients about tinnitus, like, the key thing that we want to understand is the extent to which they might be disturbed by it. Anyway, this guy loved it. Like, he explained it like this. He said, "Look, I just think it's absolute bliss when I hear it. I feel it's like an orchestra. I just want more of it. I'm just so happy when it comes, you know." And it's like, I would just point that out as kind of a little bit of extreme example, but how we think about it will determine the extent to which it's problematic for us.
So if someone is suffering from tinnitus, what do you think that person should do?
Well, I think first of all is to get the hearing assessed, because the advice that we give to someone with completely normal hearing is going to differ to those that have a hearing loss. We know that it's going to be more common when there's hearing loss, and there's different avenues that we'll take. But in either case, education, understanding the nature of tinnitus is critical. And I just come back to this comprehensive guide that we've put together. I highly recommend just schooling up on the facts about tinnitus, and whether there's normal hearing or a hearing loss. Really understanding the nature of it is going to help take away that fear of the unknown, and also give some strategies and tools to be able to cope with it.